This is Dr. Do again. This video is still on the systemic approach of medicine. Actually, I talk about in terms of systemic. I explained before, just structure-based. Talk about disease-related individual structures. Now I'm on the connective tissue, on the tissue level. Connective tissue, I talk about the epithelial tissue-related diseases, and then fat, adipose tissue-related diseases, and also talk about blood, and also last time talk about joint disease, which are also the one of the important connective tissues. Today I'm going to expand it from there. The same tissue like cartilage or the bone diseases. Both the cartilage and the bones belong to the connective tissue, which means they're cells like osteocytes, different kind of osteoclast, osteoblast, etc., and also the ground substances, the matrix. And the cartilage has different type of different kind of cartilage. They're either at the joint and also around the spine, vertebral disc, and also the ear, for example. So these are they both related to the tissue at tissue level, connective tissue. So the diseases, talk about this actually is not quite new. If I talk about the bones, the common bone diseases, for example, I already talked about that before. The bone has the major common or serious condition like the fracture, broken of the bone. And what are the risk factors for this fracture of the bone? The bone has a special structure, the cells and also the ground substance. The inorganic and organic component, which is protein versus the ions, in the optimal ratio, so give the bones flexibility and also the strength. So if it's too strong, lack of the flexibility, that increase the risk of fracture. On the other hand, if it is too much of organic component like protein, lack of the ions like calcium, for example, increase the flexibility but lack the strength. So this is the bone itself rendered this special unique characteristic, the optimal component, optimal ratio of organic and inorganic. And these are regulated by the hormones and also carried out by the osteocytes, which is osteoblast, osteoclast. So this is in detail, you can search like osteoclast, for example, if there's overgrowth of the bone, the osteoclast would just eat it out, and osteoblast will just repair it. So this is the bone structure. I just use one word. It's not medical term, but just explain to you. So, having talked about that, if the calcium deficiency that decrease the calcium, then decrease the strength of the bone, increase risk of fracture. On the other hand, if calcium too much, also without enough protein, then the bone tend to have a fragile, also increased risk of fracture. So the fracture, for example, in the children, because the bone in children are more toward the flexibility, ability. It's like not exactly you bend them, but just increase that the flexibility, which means that decrease the fracture or breaking the bone. Usually just like a branch in the spring, so you can bend them, but you cannot break them. So these are for the children's bone. So that's a typical the characteristic injury in the children. But in the older people, for example, particularly for those who had osteoporosis, I already mentioned so many times, the bone is so fragile. It's like a very loose structure, so increase the risk of fracture, just falling chips. If I explain like that, it's easy to really break down and scattered. So that's probably not the right word to put it, but just because lack of the component, either protein and calcium. So that's the fracture injury. And other diseases associated with the bones are the inside of the bone structure, bone marrow, which are the major resource for the blood cells, particularly for the flat bones. Oh, by the way, the bones in the body has different shapes, and for those long bones, just support and regulate the calcium level. And for the flat bones, there's the bone marrow. That's where the bone marrow comes from. So the bone marrow disease is either not enough or couldn't produce enough of blood cells, or it is undergoing the fibrosis. Usually this is either by the chemicals, medications, or there's some genetically caused, for example, just the fibrosis of the bone marrow. That also could happen and cause the whole blood cellular component decrease. So that's also another disease associated with this bone. And the last, I think, is just osteoporosis. I mentioned so many times because it is so common, and it seems it is probably asymptomatic. You do not know it. You do not know you have osteoporosis until one day something big happened and caused a fracture. So that's why it is common, but suddenly, particularly from last 2 decades, it's easy to be missed. So nowadays, because of the knowledge advanced, so people know that osteoporosis is really one of the major risk factors for the postmenopausal woman suffering fracture, particularly if the pelvic bone fracture. That's quite dangerous because a lot of large vessel running on the wall of pelvic bone. So if the pelvic bone increase the fragility after the injury, the fracture really life-threatening could be. So that's an emergency. So basically, what is the sign of osteoporosis? You do not know. I think just the postmenopausal woman recommended from the guidelines. Do the bone scan, the density of the bone, scanning the bone density, and to make sure whether you do or do not have the osteoporosis. But regardless, if you do have it, you're treated by the biphosphate compounds medications. If you don't have it, still probably a physician recommend you to take the supplement like calcium or the estrogen, for example, or vitamin D. So this is that is really greatly benefit for those who undergoing menopause or postmenopausal, and also risk individuals like a lean body mass, and also from Caucasian Asian descendants. That's the risk factors for the osteoporosis. So this is about the bone, and there's of course some other conditions of the bone, but it's not quite common. It could happen, for example, the tumor, but it's usually there is some genetic cause for those diseases. So I'm not going to talk about that, but just try to connect the invisible or the basic layer and foundation of knowledge to the clinic practice. So this is for education purposes, really to on the other dimension to explain about the diseases and bring up some knowledge of the bone structure. And in terms of bone regulation, I think I have talked before, the major hormones, calcitonin and the parathyroid hormone. So if you're interested, you can follow my previous video or you can search. I'm going to stop here, and thank you for watching. I'll see you next time.